The morning when Sarah Chen decided to reveal herself as the new owner of St. Mercy Hospital, she didn't storm in with security guards or make a grand entrance. No, she walked through those pristine corridors wearing basic blue scrubs, pushing a medical supply cart, enduring the same sneers and mockery she'd witnessed other staff members face. The surgical team's cruel laughter echoed through the hallway as they watched her struggle with the cart. "Look at her. Bet she couldn't even afford to be treated in our premium care wing," one surgeon whispered, loud enough for everyone to hear. Little did they know, Sarah Chen didn't just own the premium care wing. She owned the entire hospital, all 7 buildings, and was about to teach them the most humbling lesson of their careers. If you're new here, make sure to subscribe, because the story I'm about to share will change how you view success, respect, and the dangerous game of making assumptions. It had been one of those deceptively ordinary mornings at St. Mercy Hospital, where the San Francisco fog rolled thick across the bay, cloaking the city's most prestigious medical center in a mysterious shroud. The hospital's imposing glass towers pierced through the mist, its reputation for cutting-edge medical care matched only by its reputation for housing some of the most elite, and some would say elitist medical professionals in the country. Sarah arrived early, her simple Honda Civic pulling into the service entrance where delivery vehicles and support staff typically entered. She'd spent weeks planning this day, carefully orchestrating every detail of how she would experience firsthand the hospital's culture before revealing her true identity. The board of directors had kept her acquisition of the hospital quiet, allowing her this opportunity to see the institution's true colors. At 42, Sarah had built her healthcare empire from nothing, starting as a nurse's aide in a small clinic in Oakland. But today, she wasn't Dr. Chen, the acclaimed healthcare innovator who'd revolutionized patient care across 3 states. Today, she was just Sarah, the new supply staff member, invisible to those who deemed themselves above such work. As she made her way through the service corridor, pushing her cart of medical supplies, she could feel the weight of stares from passing staff members. Dr. Marcus Rivera, the head of cardiology, barely glanced at her as he brushed past, his white coat billowing behind him like a cape. "Watch where you're going," he muttered, despite being the one who'd nearly collided with her cart. The surgical floor was her first stop, where the morning's drama would begin to unfold. A group of residents huddled near the nurse's station, their voices dropping to stage whispers as she approached. "Can you believe they're letting just anyone handle medical supplies now?" one of them said, her designer glasses perched on her nose like a judge's gavel. Sarah carefully began restocking the supply cabinets, her trained eyes noting every detail, the disorganized shelves, the wasteful overstock of expensive items, the casual disregard for proper inventory management. These were all symptoms of a deeper problem, one that she'd suspected when reviewing the hospital's operational reports. Dr. Amanda Hayes, the chief of surgery, strode into the area, her heels clicking against the polished floor like a metronome of authority. She paused, manicured nails tapping impatiently on her tablet as she watched Sarah work. "You're taking too long," Dr. Hayes announced, not bothering to mask her irritation. "These supplies should have been restocked before rounds. Don't you people understand how a hospital works?" Sarah continued methodically, ensuring each item was properly placed. "I apologize for any delay, doctor. I want to make sure everything is organized correctly for patient safety." A slight smirk crossed Dr. Hayes' face as she turned to her residents. "Well, at least this one can string together a complete sentence. That's an improvement from the last one." The residents laughed on cue, like a well-trained chorus. Sarah felt her jaw tighten slightly, but kept working. She'd seen this behavior before, the casual cruelty that some medical professionals developed, as if their years of training gave them license to treat support staff like furniture. But what caught her attention most was how this attitude seemed to trickle down, infecting each level of the hospital's hierarchy. Near the board, 2 surgical techs were updating the day's schedule, their conversation clearly meant to be overheard. "Did you see her uniform? It's like she bought it at a discount store," one whispered. "I mean, if you're going to work at St. Mercy, at least try to look the part." The morning continued its descent into a masterclass of microaggressions and outright disrespect. As Sarah moved through different departments, she witnessed similar scenes playing out. In the ICU, a nurse administrator practically snatched supplies from her cart without acknowledgement. In radiology, a technician made a show of checking everything she'd stocked, as if expecting to find mistakes. But it was in the hospital's prestigious cardiac wing where things reached a breaking point. Sarah was carefully arranging specialized equipment when Dr. Rivera returned, this time with his entire team in tow. They were discussing a complex case, their voices echoing through the corridor. And that's why St. Mercy maintains its excellence, Dr. Rivera was saying, his voice dripping with self-importance. We have standards here. We can't all just walk in off the street and dash. He paused, noticing Sarah. Speaking of which, who authorized you to touch that equipment? Those are highly specialized cardiac monitors. Sarah straightened up, meeting his gaze. I'm following the standard restocking protocol, doctor. Each item has been properly sanitized and dash. Just stop, he interrupted, holding up his hand. Bradley, he called to one of his fellows. Please supervise. Whatever this is, we can't risk having untrained hands compromising our equipment. The young fellow stepped forward, barely concealing his delight at being given authority over anyone. Sure thing, Dr. Rivera. I'll make sure she doesn't break anything worth more than her yearly salary. The team's laughter echoed down the hallway. Sarah noticed how the fellow's demeanor changed once Dr. Rivera walked away, his staged authority morphing into outright condescension. Look, he said, leaning against the wall. Maybe you should stick to restocking bedpans or something more your speed. Leave the cardiac equipment to people who actually understand what they're touching. Meanwhile, in the doctor's lounge, Sarah overheard a conversation that made her blood run cold. Dr. Hayes was speaking to a group of attending physicians, her voice carrying through the partially open door. The board says we're getting a new owner, she said, stirring her designer coffee. Some woman who supposedly revolutionized healthcare in other hospitals. Probably another consultant who thinks she can tell us how to practice medicine. I heard she started as a nurse's aide. Another doctor chimed in. Can you imagine? Someone with that background trying to run St. Mercy? This isn't some community clinic. Sarah quietly logged these comments in her mental notebook, along with the names of those speaking. She'd specifically asked the board to keep her background under wraps, knowing it would draw out people's genuine reactions. The day continued to unfold like a case study in workplace toxicity. In the emergency department, Sarah witnessed a young resident nearly break down after being berated by an attending physician for asking a question. The attending had glanced at Sarah afterward, as if daring her to say something. During her lunch break, Sarah sat alone in the cafeteria, observing the clear social hierarchies at play. Staff members clustered in distinct groups, doctors with doctors, nurses with nurses, support staff huddled in corners. There was no cross-pollination, no sense of team unity. A group of nurses at the next table were discussing a recent patient case. Did you hear about the woman in 204? One asked. The one who cleaned houses for a living? Dr. Rivera insisted she be moved from the premium wing. Said she didn't fit the hospital's image. Sarah made another mental note. Patient discrimination wasn't just unethical, it was illegal. This would need to be addressed immediately. By mid-afternoon, Sarah had gathered enough evidence to justify a complete cultural overhaul. But there was one more department to visit, the administrative offices, where the hospital's bureaucratic heart beat. If you're finding this story valuable, don't forget to hit that subscribe button. Trust me, you won't want to miss what happens next. In the administrative wing, Sarah encountered Jessica Morgan, the hospital's HR director, who was berating a janitor for using the staff elevator. These elevators are for administrative personnel only, she snapped. How many times do we have to explain this? Sarah watched as the janitor, an elderly man named Frank, apologized and turned toward the service elevator, which was a considerable distance away and would add unnecessary time to his work. Excuse me, Sarah spoke up, her voice calm but firm. I believe hospital policy states that all elevators are available to all staff during non-peak hours. She'd written that policy herself last week, though it hadn't been announced yet. Jessica turned, her expression a mixture of surprise and annoyance. "And you are?" "New supply staff," Sarah replied simply. "Just trying to help ensure everyone follows proper protocol." Jessica's laugh was sharp and dismissive. "Well, new supply staff, why don't you focus on your own job and leave hospital policies to those who actually understand them?" Jessica's words hung in the air as Frank, the janitor, shuffled away. Sarah watched him go, making a mental note to review the HR department's practices first. The day was drawing to a close, and she had one final stop, the monthly department heads meeting, where she'd been instructed to deliver some supplies. The hospital's main conference room was a testament to excess leather chairs, state-of-the-art technology, and floor-to-ceiling windows overlooking the San Francisco Bay. As Sarah pushed her card in, the room fell into an uncomfortable silence. "We're in the middle of something important," Dr. Rivera said, not bothering to look up from his phone. "Just leave whatever you have and go." But Sarah took her time, deliberately placing items around the room. She could hear the whispers, see the exchanged glances. Dr. Hayes cleared her throat dramatically. "Some of us have actual patients to attend to," she said. "Could you possibly move any slower?" That's when Dr. William Chun, no relation to Sarah, spoke up, his voice carrying across the room. "You know what's funny? I heard our mysterious new owner is coming to visit today. Imagine if she walked in and saw how we treat our support staff." "Please," Dr. Hayes scoffed. "I'm sure she has better things to do than worry about supply clerks. Besides, I heard she's some sort of healthcare industry hotshot. Probably hasn't touched a supply cart in her life." Sarah suppressed a smile as she finished her task. If they only knew how many supply carts she'd pushed, how many beds she'd made, how many floors she'd mopped on her journey to the top. She checked her watch, 4:45 p.m. In 15 minutes, everything would change. As she pushed her cart toward the door, she overheard Dr. Rivera making plans for the evening. "Once we get through this meeting with the new owner, we should celebrate at Lou Blanc. No riffraff allowed, of course. Only senior staff." Sarah paused at the door, turning back to the room. "Excuse me," she said, her voice clear and confident. "The all-staff meeting is at 5 p.m. in the auditorium. That includes support staff, correct?" The room erupted in poorly concealed laughter. "Oh, honey," Dr. Hayes said, her voice dripping with condescension. "That meeting is for actual hospital personnel. Why don't you focus on restocking the supply closets?" Sarah nodded slowly. "I see. Thank you for the clarification." She pushed her cart out, leaving behind a room full of people who had no idea their world was about to be turned upside down. As she walked toward the locker room, Sarah reflected on everything she'd witnessed. The casual cruelty, the hierarchical bullying, the complete disregard for the very people who kept the hospital running smoothly. It was exactly what she'd suspected when she decided to buy St. Mercy, and exactly why she'd chosen this unconventional approach to her first day. In the locker room, Sarah changed out of her scrubs and into a precisely tailored suit. She pulled her hair from its tight bun, letting it fall in professional waves. As she applied a light layer of lipstick, she thought about Frank the janitor, about the scared resident in the ER, about every person she'd seen being diminished and dismissed throughout the day. The hospital's auditorium was filling up as she walked toward it, her heels clicking purposefully against the floor. She could see the department heads filing in, Dr. Hayes and Dr. Rivera taking their usual seats in the front row. The support staff hung back, clustering nervously near the exits, years of conditioning telling them they didn't really belong. Sarah took a deep breath, straightened her blazer, and prepared to step onto the stage. It was time to show St. Mercy Hospital what real leadership looked like. The auditorium lights dimmed as the hospital's board chairman, Dr. Thompson, stepped up to the podium. The room buzzed with anticipation, everyone eager to meet the mysterious new owner who'd purchased St. Mercy Hospital. "Ladies and gentlemen," Dr. Thompson began, his voice echoing through the space. "Over the past month, there's been much speculation about the future of our hospital. Today, I'm honored to introduce the new owner and CEO of St. Mercy Hospital Group." Sarah emerged from the wings, walking confidently toward the podium. The recognition was not immediate. Then came the whispers, the sharp intakes of breath, the widening eyes. Dr. Hayes's perfectly manicured hand flew to her mouth. Dr. Rivera's phone clattered to the floor. "Thank you, Dr. Thompson," Sarah said, her voice clear and steady. "Some of you may recognize me. I've spent today restocking supplies, organizing inventory, and experiencing firsthand how this hospital operates." The silence in the room was deafening. In the back, Frank the janitor straightened up, a small smile playing at his lips. "I'm Dr. Sarah Chen, and yes, I own this hospital now. But more importantly, I started my career as a nurse's aide, making beds and emptying bedpans. I've pushed supply carts, cleaned floors, and done every job that some of you seem to think is beneath you." She paused, letting her words sink in. Dr. Hayes had turned an interesting shade of pale, no doubt remembering her earlier comments about the new owner's background. "Today, I witnessed behavior that absolutely cannot continue at St. Mercy. I saw brilliant doctors dismiss support staff as if they were invisible. I watched nurses mock colleagues for asking questions. I observed administrators using policy to bully those they deemed inferior." Sarah stepped away from the podium, walking to the edge of the stage. "Let me be clear. This stops now. A hospital is not a hierarchy of importance. It's a symphony of professionals working together to save lives. The surgeon's skill means nothing without sterile instruments. The most brilliant diagnosis is useless without medications being properly stocked. Every role, every person in this building is essential." In the middle rows, several residents shifted uncomfortably, their earlier mockery of supply staff weighing heavily on their consciences. "Dr. Rivera," Sarah said, causing the cardiologist to flinch visibly. "Earlier today, you suggested I couldn't understand your specialized cardiac equipment. You were wrong. Not only do I understand it, but I also helped develop the latest model your department uses. But more importantly, your attitude represents everything that needs to change at St. Mercy." "Dr. Hayes," Sarah continued, turning her attention to the chief of surgery, "you suggested someone with my background couldn't possibly run this hospital. Let me share something with you. While you were making assumptions about my capabilities, I was noting how your department's infection rates are 15% higher than the national average, likely due to the toxic culture that discourages junior staff from speaking up about safety concerns." The color drained from Dr. Hayes's face as murmurs rippled through the audience. Sarah pulled up a series of graphs on the screen behind her. "These numbers tell a story, not just of medical outcomes, but of a hospital that's lost its way. Our patient satisfaction scores are dropping. Staff turnover in support departments is triple the industry standard. And our premium wing, the one Dr. Rivera thinks certain patients don't fit the image of, it's operating at 40% capacity because our reputation for elitism is driving patients away." Sarah paused, scanning the room. In the back, she noticed the supply staff and maintenance workers standing a little straighter, their expressions a mixture of surprise and vindication. "But here's what gives me hope," she continued, her voice softening. "Today I also saw incredible potential. I saw Frank from maintenance going out of his way to comfort anxious families in the waiting room. I watched Maria in housekeeping catch a potentially dangerous medication error because she pays attention to details everyone else misses. I observed James in supply management creating an innovative tracking system that could save this hospital millions if anyone had bothered to listen to his ideas." The mentioned staff members stood a bit taller, while their supervisors looked increasingly uncomfortable. "Starting tomorrow, we're implementing changes. First, every member of senior staff will spend 1 week working in support roles. Dr. Rivera, you'll start with a week in supply management. Dr. Hayes, you'll be working with housekeeping. Ms. Morgan from HR, you'll be manning the service elevators you're so fond of restricting." Jessica Morgan's face flushed red as several maintenance workers exchanged knowing looks. "Second, we're establishing a hospital-wide mentorship program, but with a twist. Senior staff will be mentored by support staff. You'll be surprised how much you can learn about patient care from the people who see everything that happens in these halls. Third, Promotion and retention will now be tied to peer reviews from all levels of staff. Your technical skills matter, but your ability to work respectfully with everyone matters more. Sarah moved back to the podium, her expression serious. Some of you might be thinking about leaving. That's fine. St. Mercy will no longer be a place where arrogance and discrimination are tolerated. But for those willing to embrace change, to treat every colleague with respect, to remember why you entered healthcare in the first place, you'll find that a hospital built on mutual respect delivers better care, achieves better outcomes, and creates a better environment for everyone. The silence in the auditorium was profound. Dr. Thompson, still standing to the side, nodded approvingly. One final thing, Sarah added. Earlier today, Bradley, one of our cardiac fellows, suggested I stick to restocking bedpans because the equipment was worth more than my yearly salary. She allowed herself a small smile. He was right about one thing, that equipment is expensive. Which is why tomorrow, he'll begin an extensive training program with our supply staff to learn proper inventory management and cost control. Bradley sank lower in his seat as several people turned to look at him. We're going to transform St. Mercy into what it should have been all along. A place of healing, respect, and excellence. Not just for some, but for everyone who walks through our doors, patient or staff. The applause started slowly, beginning with Frank and the maintenance staff, then spreading until it filled the auditorium. Even some of the chastised doctors joined in, perhaps realizing that this change, though uncomfortable, was long overdue. My door will always be open, Sarah concluded. But fair warning, you might find me restocking supplies or mopping floors, because that's what real leadership looks like. In the weeks following Sarah Chen's revelation, St. Mercy Hospital began its transformation. The changes weren't always smooth, but they were profound and undeniable. Dr. Rivera's first week in supply management was a humbling experience. After dropping 3 boxes of expensive cardiac monitors, he gained a new appreciation for the skill required to manage medical inventory. By day 3, he was seeking advice from James, the supply manager he'd previously ignored. I don't know how you keep track of all this, Dr. Rivera admitted, wiping sweat from his brow. The coding system, the stock rotation, the budget management, it's like conducting a complex symphony. James, who'd spent 15 years perfecting the hospital supply system, simply smiled. It's about seeing the bigger picture, doctor. Every item here connects to a patient's care. That's what I've been trying to tell you for years. Dr. Hayes's experience in housekeeping proved equally enlightening. After a particularly challenging shift cleaning the emergency department, she found herself sitting in the staff break room with Maria, a veteran housekeeper. You know, Maria said, handing Dr. Hayes a cup of coffee, I've worked here for 20 years. I can tell when a patient's condition is deteriorating just by observing changes in their room. Last month, I noticed unusual drainage patterns while cleaning in room 412. That's how we caught the post-operative infection early. Dr. Hayes was silent for a moment. Why didn't you ever speak up before? Would you have listened? Maria asked simply. The transformation wasn't limited to individual revelations. Sarah implemented systematic changes that rippled through every department. The hierarchy began to flatten. Morning rounds now included input from all staff members who interacted with patients. Maintenance workers shared observations about building issues that could affect patient care. Housekeeping staff were invited to infection control meetings, their practical experience proving invaluable. Bradley, the cardiac fellow, discovered an unexpected mentor in Tony, a veteran supply manager. Together, they developed a new inventory tracking system that reduced waste by 30% in the first month alone. The project earned them both a spotlight in a national healthcare management journal. Even Jessica Morgan from HR underwent a profound change. After her week managing the service elevators, she spearheaded an initiative to redesign staff policies, ensuring they promoted dignity and efficiency rather than arbitrary hierarchies. But perhaps the most significant changes were visible in the small daily interactions. Dr. Rivera began greeting maintenance staff by name. Dr. Hayes could be found sharing lunch with housekeeping team members, learning about their families and lives outside the hospital. The rigid social boundaries in the cafeteria dissolved, replaced by mixed groups sharing stories and ideas. The real impact became evident in the hospital's metrics. 6 months after Sarah's revelation, St. Mercy's numbers told a new story. Patient satisfaction scores rose by 40%. Staff turnover dropped to its lowest level in a decade. The premium wing, once struggling with occupancy, now had a waiting list, not because it was exclusive, but because it had become known for providing exceptional care to all patients. If you're enjoying this story of transformation, don't forget to hit that subscribe button. There's so much more to come. 1 year after Sarah's first day in Scrubs, she stood in that same auditorium, addressing a very different hospital staff. The atmosphere had changed. There was warmth, respect, and genuine camaraderie that transcended job titles. "A year ago," Sarah began, "I walked these halls as a supply clerk and witnessed a culture that needed to change. Today, I walk these halls as your CEO and witness something extraordinary. A true community of healthcare professionals." She gestured to Frank, now the head of a new patient experience committee. Last month, Frank's innovative patient communication system was adopted by 3 other major hospitals. "Dr. Rivera, would you like to tell them about your collaboration?" Dr. Rivera, a changed man, stepped forward. Frank's understanding of patient needs, combined with our medical expertise, created something neither of us could have developed alone. That's what happens when we stop assuming titles equal capability. Sarah shared the latest statistics. Infection rates down 45%, patient recovery times improved by 30%, and staff satisfaction at an all-time high. But more importantly, she shared stories. The night janitor who spotted a crucial symptom during his rounds, saving a patient's life. The supply clerk whose suggestion revolutionized the OR's instrument tracking system. The maintenance worker whose observation led to preventing a potential equipment failure. Success in healthcare isn't about individual brilliance, Sarah concluded. It's about creating an environment where every person feels valued enough to contribute their best. Where a housekeeper feels empowered to tell a doctor about a concern. Where a surgeon learns from a supply clerk. Where titles don't determine worth. She paused, looking out at the faces before her, faces that no longer showed the arrogance or submission of a year ago, but rather the confidence of people who knew their true value. The next time you're tempted to judge someone based on their uniform or their title, remember this: true excellence comes from respect, collaboration, and the understanding that every role matters. That's not just a nice sentiment. It's a proven formula for success. As the applause filled the auditorium, Sarah noticed Dr. Hayes wiping away a tear. The former chief of surgery had become one of the hospital's strongest advocates for inclusive leadership, mentoring new staff members about the importance of respecting every role. "And one more thing," Sarah added with a smile. "Next week, I'll be back in Scrubs, working alongside our supply team. Because good leaders never forget where they came from, and great hospitals never stop learning from every member of their team." The story of St. Mercy Hospital became a case study in healthcare management, but its lesson extends far beyond hospital walls. In every workplace, in every interaction, we have a choice to judge based on titles and appearances, or to recognize the dignity and potential in every person we meet. As Sarah often says now, the greatest transformations don't come from grand gestures or brilliant strategies. They come from remembering that every person has value, every role has purpose, and respect costs nothing but means everything. In the end, St. Mercy did live up to its name, becoming a place of true mercy, where healing happened not just in hospital rooms, but in the way people treated each other. And it all started with a CEO in Scrubs, teaching a lesson about respect that would change countless lives. Remember, success isn't about where you rank in the hierarchy, it's about how you treat people on every level. Because you never know. That person you're looking down on today might just be your boss tomorrow. If this story resonated with you, don't forget to subscribe. Together, we're building a community that values respect, recognizes dignity, and celebrates the contribution of every individual.